Hello everyone. This audiocast is for case management for Module 2, Nursing 212 on collaboration and managing. This will be the first portion of this module, scheduled to be taught on October the 20th, but due to our ASIN visitors, we will not have class on campus that day. You'll be meeting with them from 1 to 2 p.m. and then you'll have time left over to do this audio cast at your leisure. And in preparation for our guest speaker next Monday, October the 26th, I also loaded the ticket to class on Moodle last night, and that's not due until 12:30 next Monday, October the 26th. So let's go ahead and begin, and let's look at our objectives for this module. We're going to explain the definition of case management as defined by the Case Management Society of America. We're going to discuss what are the educational and experiential qualifications that are necessary for those who choose to do case management. We're going to differentiate the nurse's role as a participating member of the interdisciplinary team and as a case manager. We want to explain the roles of each of the members of the multidisciplinary healthcare team and to discuss the importance of the effective collaboration among the team members and to identify barriers to effective collaboration and methods to overcome those barriers to ensure effective collaboration among the healthcare team members. Let's look initially at the definition of case management. From 2014, the case management is a collaborative process of assessment, planning, facilitation, care coordination, evaluation, and advocacy for options and services to meet an individual's and family's comprehensive health needs through communication and available resources to promote quality, cost-effective outcomes. Now that's a mouthful, but you can see embedded within this statement are the essential ingredients of the nursing process. You have assessment, planning, evaluation, you even have those terminologies, but facilitation and care coordination would be the intervention portion, and then evaluation would be determining whether those interventions have been effective or not. And then advocacy is a little something different, although it is part of nursing's role every single day to be an advocate for our patients. But in the definition of case management, it is a little perhaps more comprehensive in that the case manager is going to serve as a mediator between healthcare team members, going to be the patient's voice in those meetings. The optimal and most effective case management strategies are to invite the patient and or their representative to the table when discussions are being held about the plan of care. However, sometimes the patient is not able to be there. They either physically are not able, or perhaps they are not cognitively able to participate in the discussions, and maybe there is no representative of the family to take part in those discussions. So the case manager particularly is being the advocate for our patients. What are the qualifications that are necessary for a case manager? Certified case managers generally hold a bachelor's degree in disciplines such as nursing, social work, and counseling. And a person can become certified as a case manager through a variety of agencies listed here. The American Case Management Association is a certifying body that focuses on hospital case management. And then there is the Commission for Case Manager Certification that is a broader certifying body that applies to both hospital and community case management, and that certification has to be renewed every 5 years, as most certifications do have to be renewed periodically. And then the American Nurse Credentialing Center also administers a certification exam for case management. So there are a variety of methods to get formal recognition and certification as case manager. The local hospital at this point does not require their case managers to be a nurse. Oftentimes they are social workers, but I believe that this specialty is gaining ground in trying to find its voice, to try to make some standardized requirements and credentials so that they are better recognized, but it's still a work in progress. So what are the functions of a case manager? Primary case management functions include these that are listed on the slide. Primarily, they're going to need to be excellent communicators because they have to give information to the patient on the level that the patient and the family understands. They have to be receptive to what the patient's concerns are, and then to communicate those concerns to the appropriate personnel. That might be the physician, that might be a physical therapist, occupational therapist, speech therapist, an outside agency like home health care, nursing home facility, hospice, and the list can go on and on. So, as all of nursing is, it's about relationship building a relationship not only with that primary person of the patient, but all of these other agencies and representatives as well. So the person that is going to build these relationships needs to be an effective communicator, both verbally and written. And that's one of the reasons that we focus on being able to develop a concise yet thorough description of the patient, or what the patient's needs are, or the current status, so that that can be utilized by the variety of people that might be involved in case management. Negotiation skills. Now, when you think about negotiation, that somewhat sounds like two warring parties, kind of against each other, when we're really all on the same team. But each member of the healthcare team has a primary purpose that they are representing. So for physical therapy, their sort of narrow focus is the physical therapy needs of that patient. That's their expertise, that's what they know. So they may not be able to see the bigger picture for that patient in terms of medications, in terms of other concerns, finances, etc. Whereas the case manager has a more global view of what this patient's situation is. And so they may need to negotiate with another entity in order to bring the best outcome for the patient. Knowledge of contractual and risk arrangements. Each entity that is involved in the care for a patient does have some legal risk, legal responsibility, and the case manager has to be sensitive to those different needs and different requirements. Enabling the patient to receive the appropriate information so that they can provide consent to participate in various healthcare activities is important, and making sure that the patient really understands what they are agreeing to. Certainly, confidentiality and privacy is utmost importance, and being culturally aware so that we can meet the needs of our patients in a variety of settings and in keeping with their cultural needs and their preferences. Critical thinking is always important no matter what aspect of nursing we are involved in. And then the case manager must be an effective planner and very organized in order to keep on top of all of the aspects of this one patient's care and deadlines and follow-ups. When they make calls, they often may have to leave messages and they have to remember to follow up. So they use a variety of methods of communication, both phones, emails, texts, a variety of ways of communicating with the various members of the healthcare team. They also are going to promote client autonomy and self-determination, because our ultimate goal, of course, in nursing is to restore the patient to the most optimal level of health and functioning that's possible, and assisting the patient to be as much as possible responsible for their own health care. Educating them, empowering them is very important. Knowledge of funding sources is a great benefit to a case manager, and this landscape of financial reimbursement, etc., is constantly changing. What insurances will pay for, what their requirements for, what needs to be documented in order to prove the need for the services, etc., are very, very important as well. What are the possible healthcare services that are available? What does the local facility, the hospital or physician's office, etc., offer? And then what is available in the community and in surrounding areas? Healthcare delivery and financing systems, understanding the interrelatedness and the competition, as well as the collaboration that is being fostered between the different systems, and clinical standards and outcomes. Certainly, if anyone in this day and age is going to pay for something, they want to, number one, have proof that it has been delivered as promised and that it is having a beneficial effect. That's also something that nursing is trying to do better in terms of establishing outcomes and documenting outcomes so that we know what are the best nursing interventions that we should carry out in certain circumstances, in patients with certain health care problems, what has been proven to work. And we need to be part of that process of gathering data and documenting information. And then, of course, there's human behavior dynamics, being able to understand the different behaviors related to illness. There's wellness behaviors and then there's illness behaviors that a patient may exhibit, and kind of being sensitive to the interplay between those is hugely important in success. This slide just is a pictorial explanation of collaboration. As you can see in the montage of words here, all of these different things are part of collaboration: building, social skills, cooperation, learning, organization, success, teamwork, knowledge, ideas, internet, using technology. All of those kinds of things are very, very important in the successful collaboration and the success of case management. And then this picture here really shows that every person at the table has a piece of the puzzle, and it's incumbent upon us to put those pieces together in the quickest, most efficient, most effective method. And the patient is the puzzle, and we need to make that patient whole by putting all the pieces together, and that's where case management can really excel in making a difference in a person's life. At the hospital, there is something called a transitional care, and not every hospital has this transitional care program, but Carteret General, or Carteret Healthcare now, has that program. And these are some of the interventions that are involved in that program. Medication management. As we know, medications cause a huge problem for patients if they are not taken correctly. They can save someone's life, but they can also take someone's life. So it is hugely important that the patient be informed about their medication, that they be able to obtain their medication, that they figure out a way to be able to take their medication regularly and without missing doses, and that they understand what is expected, what kind of effects is the medication going to have, what to expect, when to call the doctor, what to look for, etc. Transition planning is the planning of the transition of the patient from one level of care to another. So from hospital level of care to outpatient level of care. Perhaps that might include an assisted living facility, or a nursing home facility, or a temporary rehab stay before they actually land at home. So the need begins upon admission to the hospital. That's when the need for case management begins, and that's a really important aspect of this audiocast, is that planning for discharge, the case management involvement needs to begin at the time of admission. Now, not every single patient that's admitted to the hospital will need case management services, but the case manager should at least evaluate that patient that's been admitted to see whether there are needs in case management services. Patient and family engagement and education. Who is going to assist this patient when they go home? Do they live alone? Do they have a close family member? Do they have a sitter, a caregiver? Are they going to be able to take care of themselves? And then information transfer. This is a huge issue that causes significant problems for patients if the information is not transferred appropriately from one entity to another, from the hospital to the nursing home, or the hospital to the home health agency, or the hospital to the pharmacy, the outpatient pharmacy. All of those things, if the information is not transferred carefully, can result in significant harm to the patient. For example, I had a really good friend who was involved in a serious motorcycle accident several years ago, and he was in intensive care for a number of days and in the hospital 2 or 3 weeks, and then transferred to a rehab facility because he had some fractures and thus and such. Anyway, he was transferred to the nursing home. His wife is disabled due to cerebral palsy, although she's certainly cognitively functional. She has a master's degree in social work herself, but physically she has some limitations. And so she certainly was there with him when he was transferred, etc. And he was on Coumadin in the hospital. However, unfortunately, that was left off of his discharge paperwork. And when they were doing a medication reconciliation, when he arrived at the nursing home, they did not call out his Coumadin. So his wife, being fully engaged and educated, she asked about it. She said he was on Coumadin at the hospital, and they said that he would be on it when he was discharged. However, you didn't list that in his medications, and they said they would check on it. So somewhere down the line, that never got followed up on, and 3 days later, my friend had a pulmonary embolism and had to be rushed back to the hospital, etc. Another hospital stay, intensive care, etc., which could have and should have been prevented by proper information transfer. So the other thing that transitional care involves is follow-up care. The patient, when they go home, needs to already know who are they going to follow up with, when are they going to follow up, and do they have transportation to get to that follow-up visit. Healthcare provider engagement, so information needs to be transferred to the follow-up care provider, assuming that's a primary care provider. That can be done relatively safely, but what if they are being referred to a specialist in another county or another facility like Greenville, etc.? We need to have someone that is responsible for making sure that that information has been transferred, so that the healthcare provider that's going to provide the follow-up care has the information they need to follow up with that patient. And then making sure, being a part of, facilitating the shared accountability across all of the providers and organizations that are involved in this process of caring for patients. So in the hospital at now Carteret Healthcare, there's an in-hospital visit by the case manager that covers the program introduction and begins to talk about the disease. So for example, if the patient is admitted with congestive heart failure, let's say, and then they can do a home visit to do the medication reconciliation and to prepare the patient after they've been discharged to home from the hospital to prepare for their primary care visit, which is usually going to take place up to 3 days after the discharge from the hospital. And then there's a callback program that is instituted for patients in this transition of care program. They get called back at 1 week, then 1 month, 2 months, and 3 months post-discharge to see how the patient is improving, and see if there's any additional needs that have come up, to see if they kept their follow-up visit with their primary care provider. Has there been any changes in medications? Do they need any new services that they've not been able to acquire? What are their needs at this time? The goals of this transition program is to have the patient followed up within 7 days, somewhere between 3 and 7 days generally is the rule, after discharge from the hospital, to make sure that medications are reconciled prior to leaving the hospital, and then again once they get home, to monitor the patient after they've been discharged, as we said before, with the close contact, a home visit, a phone call, those kinds of things, and then to refer the patient for further assistance in things like diabetes education or smoking cessation. And then if they go home and begin to experience some symptoms, they have a contact, and this person, particularly if it's a nurse that's doing this case management, could provide post-acute assessment of their outpatient needs and help direct them to get their need taken care of most quickly. To educate the patient on early recognition of signs and symptoms that would warrant initiating an action plan, so that the patient knows, what do I do if I gain 3 pounds in a day, or 5 pounds in a week, or if I become short of breath, if we're thinking about the CHF protocols. And ultimately, we are trying to prevent readmissions within 30 days, because generally speaking, those readmissions within that time period generally are related to failure to carry out all of this plan, and they have had some sort of complication or relapse related to the previous admission. That's not always the case. Certainly something else could occur. Somebody could be sent home from the hospital after a hip replacement, and then later on they have a heart attack, or they get a gallbladder attack, or something that's totally unrelated to what they were there for before. But with that close contact, the person is more likely to have early recognition of signs that may be able to be managed and taken care of on an outpatient basis. Failing or preventing to have readmissions to the hospital benefits the patients greatly in terms of cost, in terms of keeping them at home, keeping them comfortable, preventing them from worsening, and also helping them not to be exposed to the other kinds of bacteria and things that are harbored in the hospital. And of course, it decreases financial cost for the facilities and the healthcare system in general. Of course, this is a patient-centered care coordination. Case management is patient-centered, and we want to improve the patient care outcomes. We want to be facilitators of interprofessional collaboration. So when we talk about those critical behaviors on your clinical paperwork each week, getting involved in being the communicator, being the one who is the most knowledgeable about that patient's situation, so that communicating with physicians, with the pharmacists, with other healthcare providers, the case managers themselves, physical therapists, everybody that may have anything to do with that patient. The nurse is uniquely qualified by the amount of time that she spends with that patient, the amount of information that she gathers about that patient, and that's why it is really hugely important to develop those skills of communication and being able to facilitate that collaboration. We're all on the same team. There should not be any competition or that kind of thing. And then ultimately to decrease costs over and throughout all of the healthcare settings. So what are the benefits of effective care coordination? They're listed here, and it's about what you would expect: improving outcomes for the patient, financial savings for the patient in terms of even if they have good health insurance, their co-pays, their deductibles, their out-of-pocket costs, we can reduce that and be a huge saving for patients. We can certainly lower Medicare costs and all health insurance providers' costs. We can certainly increase the safety for our patients in general in terms of transitioning from an acute care setting to a home setting or wherever, by making them feel more in control, more informed, and having a better overall satisfaction. And there are some barriers. Your book talks about this on, I believe it's page 456, about physicians' use of case managers. Now, this is becoming more widely accepted in the past 2 or 3 years, but there are still it has kind of been forced on physicians in the hospital setting, and since the local hospital has gone to a hospital physicians model, hospitalists, then they are much more likely to use case managers and to rely on them heavily. But not every hospital may use in-house case managers per se. But anyway, there has been some lack of awareness of the role of the case managers on the part of the physicians. And there has, until recently, not been very many resources or financial incentives to integrate case management into physicians' practices. That is changing. They are getting some financial benefits and incentives from Medicare and other contracted services to cause the physicians to network together and utilize a case manager, and our guest speaker next week will talk a little bit more about that. And then just resistance to change. Anything new is frightening to some people, and it's just hard to kind of get going and remember it and take advantage of all the opportunities. And then case managers themselves have not promoted their own value as well as they could. And then these are some of the ways to promote case management use by physicians. So getting the word out there. What is a case manager? What are the qualifications? Why is there a need for a case manager? And developing this standardization of their education and definition of their responsibilities is helpful. Just like with nursing, there's different levels of preparation for nursing, and that has caused us some issues over the years. For example, diploma nurses versus associate degree nurses versus bachelor's prepared nurses for entry-level practice. All three education preparation levels take the same NCLEX. But there really is some difference in the depth and of the education. So that is one thing that can benefit case managers as well. And then educating patients about the role of a case manager. Once they understand that this person is their advocate, this person is the one who can talk to all of these other people and let the patient concentrate on getting well, they are usually 100% for case management. So that is sort of, you can limit for the patient the number of the amount of effort and the number of people that they themselves have to talk to whenever they are just trying to get better, and their family member as well is trying to provide care for that person as well as take care of their own life, and it's just overwhelming for most people to navigate the system. So these are the ways that case managers and others can promote the use of case management and the ultimate effective outcome for the patients through these methods. And that really is all of the information for this module in preparation for our guest visitor next week. Be sure to read the additional resources that are loaded on Moodle, as that will also help you in preparing for next week's presentation. Thank you.